Hi, I'm Jessica Buzlog, and today I'm going to do insertion and discontinuation of a peripheral IV. I'm going to start by doing hand hygiene and putting on my gloves. I've gathered all of my supplies. I have a non-expired saline flush. I have a IV start kit. I have extension tubing and the IV catheter. I'm going to take these items out of their wrappers. Okay, I'm going to start by flushing the extension tubing. I'm going to take my caps off. Okay, I'm going to get all of the air out of my IV. I see a couple of drips. So I'm going to go ahead and set this aside. Next, I'm going to put my tourniquet on the arm here. We want it tight, but not too tight. We still want to have a distal, let me get that a little tighter, distal pulse. Okay, my patient is 78-year-old male, not expecting any blood product or anticipating a surgery. So we're going with a 22 gauge, 1-inch catheter. I'm going to take this out here. We need to clean the site. I have an alcohol swab. I'm going to clean the area inside to outside in a circular motion. I'm going to let that air dry. I'm not going to fan or anything like that. I'm going to anchor the, let me take the lid off of this first. I've got my bevel up. Okay, I'm going to anchor the vein and I'm going to come in at a 30-degree angle and insert into the vein. I'm going to see some flash of blood. I'm going to lower my needle and advance another 1/4 inch. Okay. I'm going to remove my tourniquet, and I'm going to remove my needle. Okay, in real life, I would have hit this white lever here and my needle would have collapsed into the chamber here. For purposes of this video, I need to preserve this. It is my last needle. So I'm not going to click back into the chamber, but it would be in real life in this chamber, and I would get rid of that in my sharps container. Okay, and now I'm going to quickly connect my extension tubing to my catheter. I'm going to aspirate just a little bit, see a flash of blood. And I'm going to go ahead and flush my IV. There we go. Okay, I do not see any kind of bleb forming. I don't see any discoloration. The patient's not complaining of any discomfort. So we're going to go ahead and clamp my tubing. All right, I'm going to disconnect my flush. There it goes. And hopefully we would have a Lure-Lock. If not, we need a sterile cap to maintain sterility of this IV tubing. Okay, at this time I'm going to get my Tegaderm dressing and apply that on top of my IV here. I would remove the backing and place that over the IV so that you can clearly see the insertion site. Again, for this video, I'm going to leave the paper on just in case of remediation. It's the only dressing that I have, so I'm going to leave that on. But it would be completely removed in real life. I'm going to take this tubing above, up and around the dressing, and take a piece of tape and tape that, making sure that it does not touch the dressing. I've also taken, there's a little label that has my initials, the date, the gauge, which is 22, and length of the needle, or length of the catheter, is 1 inch, 22 by 1, and that is labeled on my dressing. At this time, I would get rid of all of my supplies into the garbage. I would remove my gloves. I will perform hand hygiene and document my procedure. And then when it is time to discontinue the IV, we're going to double check and make sure the order is in, and that order is in there. So we are going to perform hand hygiene, put on some new gloves, okay, I'm going to start by loosening the Tegaderm from outer corners in towards the center. And I'm carefully removing that. Okay. Next, I'm going to remove the tape from the extension tubing. I'm going to get a piece of clean gauze and place that on top of the catheter, and we're going to pull horizontally with the skin, slow and steady out of the site. All right, we're going to inspect the catheter for integrity and length, and then everything looks as it should. We're going to dispose of that in our sharps container. I've held pressure here on this site here for 30 seconds or more, and I've made sure that the bleeding has stopped. I'm going to discard of that and get new clean gauze folded over the site. I'm going to get some tape, tape that down. Okay, I'm going to remove, I've gotten all my trash into, all discarded. Any other sharps were in the sharp container. I'm going to remove my gloves. I'm going to do hand hygiene, and I'm going to chart the procedure. Thank you.